So hi everybody again. We are continuing with our central nervous system. We are looking at the spinal cord at this point. We were talking about the anatomy of the spinal cord, and in this picture we are gonna kind of take a look at the structure and try to label them again. So remember that the internal structure you see right here, this would be your gray matter, and the area around would be your white matter. We also mentioned that you first need to identify your fissure, which is right here, versus your sulcus. Fissure would be the anterior aspect, and the sulcus would be the posterior. So we have anterior median fissure versus posterior median sulcus. The gray matter are labeled posterior gray horn, lateral gray horn, and anterior gray horn. And the white matter would be the posterior or dorsal white column, lateral white column, and anterior or ventral white column. And then coming off of the directly off of the spinal cord, in the back you have your dorsal root, and in this picture they're not depicting the ramus, but if we can continue that, then become the ramus or rami if we're talking about both of them. We also talked about that the gray matter on either side is connected via what we identify as the gray commissure, and at the center of the gray commissure you have the opening, which is your central canal, where your cerebrospinal fluid passes through. Now, I mentioned roots and ramus. So what are the differences between the roots and ramus? Roots, which are medial to your spinal cord or closer to your spinal cord, are identified as the structure that are either strictly sensory or strictly motor. So what does that mean? If we're talking about dorsal or the posterior aspect of the roots or posterior roots, they only and only receive signals into the spinal cord. Now, it doesn't matter if this sensory data is coming from the front or back. This data, the point is that this data is always going to be associated with sensory. The data that is coming out through the ventral root, as I'm coming from the front of the body or the front of the spinal cord, that data is always motor data. As in, regardless of if this data needs to go to the back of the body or to the front of the body, we identify if it is motor, it has to come through the ventral root. Rami or ramus, if we're talking about only one of them, are actually both sensory and motor. So their goal is not to separate based on sensory or motor. Their goal is to separate based on where they are going to go or where are they collecting data from. So if we're looking at the dorsal ramus, the data is usually associated with the back of the body. Again, it doesn't matter if you're collecting data from the back of the body, hence sensory, or if you're sending a message to the back of the body as a dorsal, as a motor. So if data is going to the back, regardless or collecting from the back, it's going to go through the dorsal ramus. If the data is being collected or sent to your front of the body, that's the ventral ramus, or it passes through the ventral ramus. So remember the color coding we talked about before? The blue color in this picture is always going to be your sensory, and the red is always going to be your motor. So notice again, the ramus, which is the portion that is in the back, this part and this part. Notice both colors are present, right? Because ramus doesn't distinguish if the message is sensory or motor. The ramus is distinguishing what? If you're in the back, regardless of what type of data, I'm gonna go through the dorsal ramus. Ventral ramus, it says if the data is associated with the front, can it be sensory or motor? Don't care. If it is coming to the front of the body, I'm going to pass it through the ventral ramus. Now, data in terms of your roots change. Root says, I really don't care if you're coming from the front or back. What I care about is, are you sensory? If you are sensory, the only way that you're going to come into the spinal cord is through what? The dorsal root. For ventral root, it says, I don't care if you're going to the front or back. My concern is what? Is your data motor? If you're coming out of the spinal cord, you come out through the front door, basically. Think about it. If you are bringing me data, regardless of where that data is coming from, you're coming through the dorsal root. Same picture here, just the same depiction. So they're just showing you the roots versus ramus and the ganglia. Last concept of this lecture is focusing on what we identify as nerve plexus. They are network of ventral rami, basically again, the ones that are going to the front of the body, with the goal of providing interlacing network and creating redundancy just in case one of these nerves are damaged. Now, a common mistake I see is students think about this in the terms of a spinal cord. No, it is not, even though there are shared names. The four plexus we have is cervical, which is associated with only C1 through C4. Brachial, as in your arm, this is associated with supplying your arm with multiple and redundant nerve system and branching. Lumbar region or lumbar plexus, which is L1 through L4. And the last one is sacral, which is associated with L4 to S4. Now, how detailed do you need to know these nerve plexi? Not detailed. I don't need you guys to look at the division. I don't expect you guys to know the root, trunk, division, cord branches. What I do want you guys to understand is that these nerve plexes are very complex, and within each of these four plexi, you have important nerves that you probably have heard of them, or you can see their extreme importance in terms of making your body properly work. So when we're talking about the cervical plexus, the most important nerve that we can kind of highlight is the nerve that is innervating your diaphragm. That's called the phrenic nerve. Phrenic nerve is the one that causes the contraction of the diaphragm during the process of breathing. Hence, you can see the importance of that. Brachial plexus. There are three main branches that comes off of the brachial plexus, which is the axillary, radial, and ulnar. Auxiliary is important in terms of covering the armpit region and shoulder. And you have radial and ulnar, as the name implies, either running on the side of the radius or the ulna. And then right in between them, what I didn't write here is a nerve called the median nerve that runs, again, right in the middle of the arm. Now, each of these nerves, if there is damage to them, there is an actual limitation in terms of your hand movement, or more specifically finger movement, but I don't expect you guys to know that for this class. Lumbar plexus and sacral plexus. The important nerves for the lumbar plexus is a femoral nerve. As the name implies, this is a main nerve that is going down the leg, covering the anterior aspect of the thigh region, and basically your quadriceps muscle, and then it continue going down and partially innervates the leg, knee, and foot. And you can track the nerve going down. For the sacral plexus, the most important nerve, which probably everybody has heard of, is sciatic nerve. Sciatic nerve is the thickest and longest nerve in the body, and it literally innervates from the hip region all the way down to the hamstring muscles and going down all the way through the leg and the foot. So if I ask you guys again, what is the most important or one of the most important nerves in terms of sacral plexus? Remember S for S, that would be the sciatic nerve. For lumbar plexus would be femoral nerve. For brachial, it would be axillary, radial, ulnar, and median. And for cervical, it would be phrenic nerve. So that's about it for this PowerPoint. We will continue our last lecture for the nervous system by reviewing the autonomic nervous system and the effect of parasympathetic and sympathetic nervous system.